Good morning. This video is Learning Theories and Behavioral Changes by Toby Lamb. This presentation is for Graduate Studies Aspen University course N582 Teaching Strategies in Nursing Education, Module 1 assignment. The instructor for the course is William Hall. The due date is June 22nd, 2026. In this presentation, I will discuss how major learning theories can be used to increase or decrease behavior and how these theories can be combined to support learning and behavior changes in nursing education and clinical practices. The theories discussed will include behaviorist, cognitive, social learning, psychodynamic, and humanist theories. As nurse educators, preceptors, and mentors, we influence behavior every day, whether we are helping a patient adapt healthier habits or teaching a new nurse to safely care for critically ill patients. Our success often depends on understanding how people learn. Learning theories provide evidence-based frameworks that help educators select appropriate teaching strategies, identify barriers to learning, and facilitate meaningful behavior changes. Behaviorist theory is based on the principle that learning occurs through observable behaviors and responses to environmental stimuli. According to Gandhi and Mukherjee, behavior is shaped through reinforcement, punishment, repetition, and conditioning. To increase desired behaviors, educators should use positive reinforcement and rewards. This may include praising a nurse for correctly identifying patient deterioration, providing competency validation after successful skill performance, recognizing achievement during orientation, or offering immediate feedback after a successful intervention. The learner begins to associate the behavior with positive outcomes and is more likely to repeat it. Behaviorist theory can also decrease undesirable behaviors through extinction and corrective feedback. Some of these examples might be addressing unsafe medication administration practices immediately, removing reinforcement for inappropriate shortcuts, or requiring remediation when unsafe actions occur. Behaviorist approaches work especially well when teaching psychomotor skills because repetition and reinforcement help establish competency and consistency. Cognitive theory focuses on how learners process information, solve problems, and develop understanding. Rather than simply changing behavior, cognitive theory seeks to improve thinking and clinical reasoning. Desired behaviors increase when learners understand the rationale behind their examples. For example, a nurse is more likely to properly titrate norepinephrine if they understand vascular physiology, cardiac output, blood pressure regulation, and drug mechanism of action. Understanding creates meaningful learning that can be transferred to new situations. Undesirable behaviors decrease when misconceptions are corrected. For example, a learner who believes medication titration is simply adjusting numbers on a pump may be taught to interpret hemodynamic data, patient assessment findings, and treatment goals before making their adjustments. Cognitive theory is especially valuable in nursing because nurses frequently make complex clinical decisions that require critical thinking and judgment. Social learning theory, developed by Albert Bandura, emphasizes learning through observation, imitation, modeling, and self-efficiency. Desired behaviors increase when learners observe competent role models. Learners can observe and watch experienced nurses conduct a rapid assessment, observe effective communication with physicians, or witness expert clinical decision making during emergencies. Learners will often imitate behaviors they observe in respected mentors. Undesirable behaviors can decrease when learners are exposed to positive role models instead of negative role models. For instance, a nurse who has observed poor documentation habits can learn more effective practices by working with a skilled preceptor who models evidence-based documentation. Bandora's concept of self-efficiency is especially important because learners who believe they can succeed are more likely to attempt challenging tasks and persist when difficulties arise. Psychodynamic theory recognizes that emotions, unconscious motivations, previous experiences, and anxiety influence learning and behavior. Desired behaviors increase when educators create psychologically safe learning environments. Students should be encouraged to ask questions without fear of criticism. Educators should support learners during difficult clinical experiences and provide constructive rather than punitive feedback. Undesirable behaviors may be reduced by addressing the emotional causes underlying those behaviors. For example, a nurse who avoids critically ill patients may not lack knowledge, but instead have anxiety related to previous negative experiences. Psychodynamic approaches help educators recognize that learning barriers are not always cognitive deficits. Sometimes learners know what to do but are emotionally unable to perform. Humanist theory emphasizes personal growth, self-direction, intrinsic motivation, and learner autonomy. Desired behaviors increase when learners participate in goal setting and perceive relevance in what they are doing. Educators can grow this behavior by allowing students to create individualized learning plans, choose educational goals, and encourage self-reflection. Undesirable behaviors decrease when learners develop insight into how their actions align with their professional values and goals. Instead of focusing on punishment, humanist educators focus on personal responsibility, growth, and self-improvement. Humanist theories align particularly well with adult learning because adult learners are often motivated by professional development and personal achievement. Although each theory provides valuable insight, no single theory fully explains learning or behavioral change. Effective nurse educators combine multiple theories when teaching. For example, when teaching medication titration, behaviorist theory provides reinforcement and repetition. Cognitive theory develops clinical reasoning. Social learning theory uses role modeling. Psychodynamic theory addresses anxiety and confidence. Humanist theory provides self-directed growth. Bastable notes that effective nursing education should address cognitive, psychomotor, and affective domains simultaneously. By combining theories, educators can meet learners where they are and maximize learning outcomes. We will now review the following scenarios. Scenario 1, nurse orientee struggling with medication titration. If a nurse orientee has difficulty understanding how to titrate medications based on physiological data, several learning domains can be affected. Cognitive defects, the orientee may struggle with pharmacological concepts, hemodynamic monitoring, interpretation of vital signs, clinical reasoning. Radoval et al. Found that nurses who demonstrated greater confidence and stronger decision-making abilities were more likely to successfully titrate and safely titrate vasoactive medications. Psychomotor defects. The orientee may have difficulty operating infusion pumps, performing simultaneous assessment and intervention, managing multiple tasks. Affective defects. The orientee may experience anxiety, fear of harming patients, low confidence, performance stress. Before intervening, I would assess previous ICU experience, pharmacology knowledge, understanding of physiology, comfort with equipment, confidence levels, and clinical reasoning process. I would talk to the student and figure out what's going on in their head. According to Miller, problem learners often have multiple contributing factors that require comprehensive assessment before remediation strategies can be successful. Scenario 2, counseling a failing nursing student. Using self-efficiency theory, my primary goal would be to build their confidence. I would identify their strengths, set achievable goals, create opportunities for success, and celebrate incremental improvements. Claudy and Taufik found that students with higher self-efficiency demonstrate greater resilience and are more likely to recover from academic setbacks. Attribution theory. Using the attribution theory, I would focus on how the student explains failures. I would ask questions like, why do you think you are struggling? What factors contributed to your performance? If the student believes failure is caused by fixed traits, such as intelligence, I would help reframe the discussion towards controllable factors such as study habits, time management, and utilization of support resources. Self-efficiency theory focuses on confidence, while the attribution theory focuses on perceived causes of success and failure. Scenario 3, social cognitive theory and clinical preceptorship. Social cognitive theory is highly effective in the clinical education. As a preceptor, I try to demonstrate skills, think aloud during clinical decision making, encourage student observation, provide guided practice, and offer constructive feedback, as well as foster self-reflection. Barham et al. Found that successful adoption among newly graduated nurses is strongly influenced by mentorship, supportive learning environments, confidence building, and positive role modeling. By observing expert clinicians and gradually assuming greater responsibility, preceptees develop confidence, competence, and professional identity. In conclusion, learning theories provide powerful tools for understanding how behavioral change occurs and how learning can be enhanced. Behaviorist theory uses reinforcement, cognitive theory develops understanding, social learning theory emphasizes observation and modeling, psychodynamic theory addresses emotional barriers, and humanist theories promotes self-directed growth. While each theory offers unique strengths, the most effective nursing education strategies often combine elements from multiple theories. As nurse educators, preceptors, and mentors, understanding these theories allow us to better support learners, improve patient outcomes, and foster professional growth. While teaching a new nurse how to titrate medication, counseling a struggling student, or helping a patient change health behaviors, these theories provide valuable guidance for promoting lasting learning and behavior changes.